The past 15 years or so have been a very dynamic time for the development of health services and policy research in Canada. And so as the opening act to this sub-plenary, I'd like to give you a quick outline of some of those historical developments. It all began in 1996 when, lucky for us, the Canadian federal budget included the establishment of a health services research fund to improve the scientific basis by which decisions were made by our healthcare leaders in our various health service delivery agencies. Very soon following that, in 1997, and with endowed funds from the federal government, there was a creation of the Canadian Health Services Research Foundation, or CHSRF as we all know it. And its purpose was threefold. It was to fund research, health services and policy research, build capacity, and also something that was really quite unique at the time was really to focus on how do we transfer the results of our research to those to whom it really makes a difference, to those who need to apply it. Because any of us who are faculty members can be quickly humbled if we look to see how many times our peer-reviewed journal papers have been cited by people. And we know that that isn't a great mechanism for getting the research to the users. And so CHSRF really worked hard at the time to develop the whole science of knowledge transfer. And obviously they were supporting evidence-informed decision-making through all these activities. Soon after, in 2000, the CIHR Institute of Health Services and Policy Research was created, and it had a very similar mandate to that of CHSRF, which was to improve our healthcare service delivery, and again, through three areas, the same as CHSRF, promoting research, the conduct of research, building capacity, and knowledge translation. In 2001, it made a lot of sense for HSPR and CHSRF to join forces, and together they created the CADRE program, the Capacity for Applied and Developmental Research and Evaluation. And this was to increase capacity in health and nursing services research through 4 different activities: the creation of chairs, the creation of regional training centers, both of which I'll tell you a little bit more about in a few minutes, postdoctoral training, and career reorientation. And this program was co-funded by the 2 entities and administered through CHSRF. And I had an opportunity, being a totally non-athletic person, to be awarded the Triple Crown by CHSRF, in that I was able to, I was honored to be given a chair, to be given the directorship of a regional training center, and to supervise a number of postdoctoral trainees. In order to really learn more about what health services research should be done in Canada, both CHSRF and HSPR again combined forces to co-lead Listening for Direction 1, 2, and 3 in the respective years of 2001, 2004, and 2007. And this was a time to really identify priority research areas. In 2004, the Canadian Association for Health Services and Policy Research was launched, and this was to broaden membership of an existing association, which was the Canadian Health Economics Research Association. And in 2004, when Cahspr was formed, it had 400 members. The exciting thing about CHSRF is it wasn't only the students who they felt that they needed to build capacity in, but they also wanted to look at it from the decision maker, the policymaker's point of view. How can we help policymakers, decision makers, to better utilize evidence in their decision making? And so, with funding from a variety of different entities, the EXTRA program was created, the Executive Training for Research Application. And this was for senior administrators across the country, and I'll tell you a little bit more about that in a few moments. 2005 was the first issue of Healthcare Policy, a very unique journal published by Longwoods, unique in that it too fostered the partnership and the collaboration between researchers and policymakers. And so those two different groups are represented in all aspects of the journal in terms of its editors, in terms of its contributors, and in terms of its audience. I think something that we should be very proud of in terms of being able to really work together to move scholarship forward in that partnership. So the CHAIR program. 12 leaders in health services and nursing research. Our emphasis was on capacity building and linkage and exchange. And during those 10 years, we launched a variety of different activities that allowed us to mentor and educate junior researchers, train graduate students across the country, build national research networks, conduct policy-relevant research via our students and our trainees, and engage decision makers and policymakers as partners in all that we did. And it's very important to realize the emphasis on building capacity. For me to take on this chair, I actually had to give up my Career Scientist Award, which was allowing me to be an independent researcher. And this was very much a mandate of training, building the future, and working with students all across the country as opposed to at McMaster University in order to build that capacity. Together, the chairs trained over 700 trainees in those 10 years. And we've all written chapters for a book that is forthcoming from the University of Toronto Press called Towards the Application and Utilization of Health Service and Nursing Research, Critical Reflections on the CHAIR program. Could I ask those who have held one of these chairs to stand if you're here in the room? Okay, Jean-Louis Denis is one of the chairs. Yes, great, thanks. Okay. On to the regional training centers, again funded for 10 years, 4 of them across the country. We had the Atlantic Regional Training Center with all 4 provinces represented with their universities, the Centre de Formation et d'Expertise en Recherche en Administration des Services Infirmières. Apologies, Carl, for my poor French. We know it as FARACI, the Ontario Training Center, and then the Western Regional Training Center, which included a number of the Western provinces. We were funded for $16.3 million over 10 years, and I should have mentioned that the CHAIR program, was funded for about $18 million. Very unique program in that it insisted that often very competitive universities work together as a consortium to deliver this program. And in so doing, we were able to offer multi-university, interdisciplinary, distance graduate education. Again, very active engagement of decision makers who were helped us to deliver this program in many ways, helping us plan the Summer Institute and deliver it, supervising policy internships for each of our students, and helping to engage students in employment after their graduation. Very strong emphasis on linkage and exchange, and you'll hear more about that probably from Steve as he talks about the competencies. And together, the 4 training centers trained over 500 trainees. So, as I mentioned, some of the common methods of training the students involved week-long, intense summer institutes that brought together researchers and decision makers and students to learn together. Most of our training centers and CHAIR programs require the students to spend at least 100 to 200 hours in a policy setting where they learned what it was like to be a policymaker and also helped to provide some evidence for the policymakers in terms of a win-win situation where they could help one another. Distance courses, as I mentioned, and some students also did research practica in addition to their thesis where they worked with senior health services and policy research teams. Together, the 4 regional training centers produced a special issue of healthcare policy in 2008. It includes 10 papers about the training centers and is fully and freely available online through the Longwoods website. The extra program, as I mentioned earlier, provided an opportunity for healthcare executives to acquire the knowledge, skills, and competencies to use research-informed evidence in decision-making. They actually designed an intervention project, which they then went on to implement and evaluate in their setting. To date, 233 extra program fellows have participated in that program. That program will continue until 2014. So where are we 15 years later? The CHSRF-CIHR training centers and chairs have completed their 10-year terms. Over 1,200 trainees have participated in the cadre program. The cadre graduates, with a small survey that we have done in Ontario, we find that about a third of them are in university academic positions, a third in postdoctoral training, and a third working in policy settings where we think that they are increasing the receptor capacity for health services research. And I think that over the 10 years, there has been a very big increase in the emphasis on knowledge translation skills and activities on various agencies in Canada, such as CIHR. The cadre program influenced the creation and funding of other training opportunities, such as the CIHR STIR program, the Strategic Training Initiative in Health Research, and the ISPR and Public Health Applied Chairs. There are now increased opportunities for health services research funding, and thanks to Robin and all her team, a substantial amount of money going into the recent community-based primary healthcare team grants that are LOIs being reviewed as we speak. Almost 300 institutions have online access to healthcare policy, and at this conference and today there are over 600 registrants, 30% of whom are students. And I think this is something that this association needs to be very proud of, because the students, and I shouldn't speak for the students, but from what I've seen, Cahspr has worked very hard to embrace and really welcome the students and have them actively participate in all phases of the conference. Well, $35 million. $35 million went into training building capacity of health services and policy research over the past 10 years. That's a substantial chunk of change. And it took two risk takers to be able to say to entities like CIHR, no, we're not ready right now to really increase the amount of health services and policy research being conducted in Canada. And the reason we're not ready right now is because we don't have a strong enough, large enough group of health services and policy researchers. So we need to take a step back, and we need to build that capacity first. And that did take a lot of courage. And I think these are two people who, for those of us who know them, are just the right people to partner up to do that. And Jonathan Lomas, as the former Chief Executive Officer of CHSRF, and Morris Baer as the first Scientific Director of ISPR, were those risk takers, were those pioneers. And so now it remains to you, our students, our graduates, to move us forward in the area of health services and policy research, and build that body of research that will help the Canadian healthcare system become better and better with time. Thanks very much.